Some small clinical trials have shown that your blood type can impact how badly your COVID-19 symptoms are. But doctors at UAB say there is not enough data right now to support whether your blood can affect your risk for developing the virus. Dr. Marissa Marquez says everyone should avoid getting infected. And no matter your blood type, doctors are in need of blood donations from the general population and also from people who have recovered from the virus.
A good number of them may have formed antibodies, mounted an immune response against the virus. That immune response is present in their plasma, and that plasma could help a ill patient in the hospital to recover from the virus more often.